This video will cover postpartum depression and the Edinburgh Postnatal Depression Scale. Postpartum depression, also known as PPD, is a mood disorder that can affect women shortly before or soon after giving birth. It is a severe, long-lasting form of depression that interferes with the mother's ability to care for her baby and handle daily tasks. The American Psychiatric Association estimates that 10 to 20% of mothers experience postpartum depression. Some causes of postpartum depression can include previous depressive episodes and/or a family history of depression, a lack of social support, anxiety, marriage or money problems, stress, and substance use disorder. While these are some possible causes, any woman can experience postpartum depression, and it has no relationship to a mother's ability to be a good mother to her child. According to the National Institute of Mental Health, some symptoms of postpartum depression can include excessive crying, withdrawal from family and friends, overwhelming fatigue or loss of energy, hopelessness, inability to sleep or sleeping too much, difficulty bonding with baby, and thoughts of harming oneself or the baby. The most common measure to screen for depression related to childbearing is the Edinburgh Postnatal Depression Scale, or EPDS. The EPDS was developed in 1987 by researchers in the UK. These researchers include Cox, Holden, and Sagavotsky. The EPDS is a 10-item self-report screening tool. It is only to be used as a screening tool and not a diagnostic tool. The 10 items on the screening tool ask a mother how she has felt within the past 7 days. These scores are calculated by adding individual responses to each of the questions. A score of 13 or higher indicates the need for referral and follow-up. The purpose of this screening tool is to help identify mothers that might be at risk of depression or mothers that are currently experiencing depression. The cost of the screening tool is free, and it has been translated in over 35 different languages. The use of this screening tool continues to grow and also supports the validity of this screening tool. In the original British validation study in 1987, 9 out of 10 women who were diagnosed by a psychiatrist as being depressed after giving birth were correctly identified in a blinded comparison with scores above a cutoff on the EPDS. The EPDS yields 86% sensitivity as it relates to correctly identifying true cases and 78% specificity as it relates to correctly identifying people without the condition. As previously stated, the EPDS is the most common screening tool used for assessing possible depression in new mothers. While this is the case, another tool that has been used is called the Postpartum Depression Screening Scale, or the PDSS. This is a 35-item self-report screening tool that takes 5 to 10 minutes to complete. This screening tool also identifies women who are at high risk for postpartum depression so they can be referred to the appropriate personnel for diagnosis and treatment. While the Edinburgh Postnatal Depression Scale is the most commonly used measure and yields high validity, there are some critiques of this instrument. One of which is that it only examines the past 7 days. It does not examine any type of behavior or symptoms outside of that time frame. Also, there are some cultural differences in how women may respond to the question based on how they view or interpret their emotions. Also, the stigma that is associated with PPD in some cultures may also present cultural considerations that need to be taken into account when administering the EPDS. Finally, this is just a screening tool, and it is not a diagnostic tool. However, there have been instances when it has been used as such. It is important for those that administer this self-screening tool to not use it as a diagnostic tool. Additionally, since it is a self-report questionnaire, Practitioners using this screen tool should always follow up to questions if they feel that it may be useful, as some results can be positively or negatively skewed. Postpartum depression affects many women, and there is still more research to be done so that it can be adequately addressed and diagnosed. Also, it is my hope that there are more screen tools.